What's totally surprising to people is how very young dogs can have quite severe disease. So we're now going to look at a 6-month-old dog, and it'll come as a surprise to many people watching this that this dog is affected by significant medial coronoid disease already. So what I'm going to show you now is the physical examination and how much discomfort those little dogs are in. And it's our moral responsibility to get those dogs out of pain. That's our moral responsibility as a society and as veterinary surgeons and as animal guardians. That's our job, to get them out of pain. So that's what we're going to aim to do. But what is totally shocking to most people is how bad it can be even at 6 months of age. All right, sweetheart, let's have a little look then. Okay, so this is Xena, and she's got pain in her elbows. And if we look here, we can see, it's all right, sweetie pie, she's lame on both front legs, and this is often deceptive, so it's very difficult for people to understand that their dog is really lame if they're lame on both sides. So you just can't tell because the dog's lame on both sides. Telltale sign, there's a little bit of puffiness here. So I'm pressing that with my finger. That's called synovial effusion or swelling of the joint. And that's swollen because the joint is inflamed, and the joint is inflamed because inside the joint in here, this is cracking off because of pressure. Pressure which is occurring down the inside of the elbow here because this elbow doesn't fit right. And here we go. So when we flex the elbow and we drive the two bits that hurt together, that's enough, that's enough, that's enough. You can see it's extremely painful. It's extremely painful. And the poor little dog literally doesn't have a leg to stand on because the front two legs are both extremely painful. And this is why I'm passionate about developmental elbow disease in young dogs, because a dog like this, completely defenseless, beautiful, lovely dog, doesn't have a chance unless we are responsible and try and get this dog out of pain. So that's what we're going to do next. We're going to do the diagnostics, we're going to do radiography, we're going to do CT scan, we're going to do arthroscopy. Developmental elbow disease, or elbow dysplasia as it's commonly called, is a very common problem in young, large breed growing dogs. If we look at the skeleton here, the elbow is this region here. A lot of people think that when their dog is lame on the front leg, that, oh, he must have a shoulder lameness because he's dipping down like that. That's not true. A lot of times the dipping of the shoulder will be representative of an elbow lameness or even a foot lameness. But I would go so far as to say that if you have a young Labrador or a young large breed dog of any kind with lameness of the front leg, less than a year of age, then it's elbow until proven otherwise. So in other words, I'm a very strong advocate of getting a diagnosis. I'm not an advocate of leaving those dogs lame. I understand that giving them medicine will ameliorate their lameness. I get that. But I think the fundamental question is, what is causing the lameness? And is medicine enough? And I think that this is very dependent upon what kind of disease these dogs have. And it's not enough to say, oh, it has elbow dysplasia. It's not enough. What it has to be is a definitive, specific diagnosis about what kind of elbow dysplasia. So ultimately, under this broad catchment term of elbow dysplasia, a lot of people watching this will think, oh, well, I know what elbow dysplasia is. It's a cartilage flaking off inside the joint, or it's a poor fit of the elbow, or it's elbow not growing right. Well, lots of people have different opinions, but what you need really is a proper diagnosis, and that diagnosis initially is based on X-ray of the elbow joint itself, then CT scan, and then arthroscopy if necessary. And ultimately, what we're looking for is the different forms of developmental elbow disease. So the X-ray, the radiograph, may show, for example, that there's an increased whiteness in this region here. And that may be all that you see on an X-ray. So you may just see an increased whiteness here, and it can be very, very subtle. If you have a young dog and it's lame, I would absolutely encourage you to get a diagnosis, a proper diagnosis, because then and only then can you decide to give that dog just medicine or to do a surgical intervention. And the surgical interventions vary enormously. So it's not, I have two things that are really important to say. One is, it's not enough to say, oh well, my dog Joe did much better than Joe Bloggs's dog Peter because it had surgery on its elbow. So therefore, de facto, either the surgery that was done on my dog was better than Peter, or Peter's op was not successful because the surgery wasn't done right. That's ridiculous. That's like comparing apples and oranges. Different surgeries can be done, and indeed you're treating different conditions. In a recent paper that my colleague Michael Farrell and I worked on, we found hundreds of patterns of elbow disease. So this term elbow dysplasia is a miscalculation, I think, of the profundity of the disease. So I prefer to call it developmental elbow disease. I prefer people to understand that there's many hundreds of forms and not just a handful of forms. And I prefer people to understand that it's not a one-size-fits-all. Some dogs do benefit from surgery, some don't. So you can't say, de facto, don't do surgery on elbow disease because it doesn't work. That's just simply untrue. So we need to compare apples with apples, and therefore we need to decide, has the dog got Osteochondritis Dissecans, which is a hole in the bottom of the humerus called OCD? Because if it does, then there's two basic treatment mechanisms, one where you scrape the hole away and the other where you transplant the hole with a graft. And nowadays we use a synthetic graft which is comprised of plastic with metal so that the plastic resurfaces the joint. And then we have to cut this bone here, which is called the ulna, to allow the joint to not rub so much. So by doing this graft and by cutting the ulna, we get a very good outcome for these cases of OCD, osteochondritis dissecans. So that's one form of elbow dysplasia or developmental elbow disease. Another form is Ununited Anconeal Process, where the tip of this, the top of the elbow, detaches. And then depending on how much is detached or not, again we can cut the ulna. The angle of the cut is like this. It's a long angle cut, so what happens is the muscle tips that backwards and it decreases the pressure between here and the rest of the elbow. And here and the rest of the elbow is where most of the friction occurs. If you have Ununited Anconeal Process and this is detached, if you cut the ulna here, it releases this notch from the humerus, and this can heal back on if it's loosely attached, or you may be able to screw it back on and cut the ulna. So now I've talked about two types of developmental elbow disease: osteochondritis dissecans, OCD, Ununited Anconeal Process, UAP. But those two forms pale into insignificance by comparison with the main form of developmental elbow disease, which is medial coronoid disease. So this is the coronoid process here, which in you and me is in here, and in a dog is in here. And it's the inside of the elbow. So it's the inside of the elbow where this bit rubs against that bit. And medial coronoid disease used to be called Fragmented Coronoid Process, or FCP, but because 40% of them are not actually fragmented, it's a misnomer. It should be called Medial Coronoid Disease. So this is rubbing against this, and we've published many papers on this now looking at how this happens. And what happens is that this rubbing against that causes an earthquake, which I will show you now. As the joint moves with the muscle here pulling it, this bump here called the coronoid process hits against the radial head here, and an earthquake happens. So if we look straight down on that bone, the earthquake happens here. I'll play that for you one more time. So this is moving all the time. This inside of the elbow is hitting against the radial head here, and an earthquake happens here. All the while the humerus is bearing down on this. So this bit doesn't fit properly and rubs here or both. And as a result, you get either an earthquake or an avalanche coming off the tip of that. And you may not actually get the earthquake or the avalanche giving rise to fragments. What you may have is just rubbing. So just like you have rocks falling on a cliff edge in an avalanche, or you have two tectonic plates moving in an earthquake, you can get movement with minor shocks, but without the actual fragmentation. And that's the key here. People have this idea that, oh, we'll go in and we'll take out the fragment. Well, first of all, 40% of them don't have a fragment. They've got pre-shocks or aftershocks, but they don't actually have a fragment. Secondly, the fragment isn't the real issue. The issue is that rubbing against that. And that's called humero-ulnar conflict. Conflict between the humerus and the ulna. And 9 times out of 10 in developmental elbow disease, the inside of the elbow gets rubbed away. So we will perform arthroscopy on elbows every day. I'm going to do 2 now, where this is rubbed against that, and it causes a severe degree of erosion between one side and the other side. And that is the crux of the problem. So the crux of developmental elbow disease generally is a poor fit of the elbow, and unless we address that somehow, we can't address the fundamental problem. So going in, a lot of times we will focally treat it. We will take out the fragments and maybe take out the tip of the coronoid process, which is called a subtotal coronoid ostectomy. But anyway, even if we take out bits, the key thing to understand is if you take a shoe that is fitting a foot poorly and you take the rock out of that shoe, but the shoe still doesn't fit, the shoe is still not going to fit even if you take the rock out. And therefore your foot's still going to hurt. And in this case, the elbow's still going to hurt. So this whole concept of developmental elbow disease being always able to be treated arthroscopically or always being able to treat it just with medicine is untrue. It's different for different dogs. And just to finish up, whilst developmental elbow disease or elbow dysplasia has over the years adopted this umbrella which encompasses lots of different conditions like OCD, like UAP, the main one is Medial Coronoid Disease, MCD, and the main reason for all of that is a poor fit of the elbow. So what would I say to people who have a young large breed dog that's lame, especially a Labrador in the UK, or a Springer Spaniel, Bernese Mountain Dog, Mastiff, lots of breeds, Newfoundland, lots of breeds. I would say get it checked out. An X-ray radiography usually will tell you if it's there or not in most cases, but it won't tell you specifically what to do. CT scan and arthroscopy is necessary for that, and it's not one size fits all. It is a spectrum of pathology with different things that can be done along the way, which is called the elbow algorithm of treatment choice. So you have a treatment choice right through from very mild to very severe, and it behoves the veterinary profession to help people out there to make the decision where along that line at that moment in time that dog is. Because if the dog is 6 months old relative to 3 years old relative to 13 years old, that's going to alter what you're going to do. So I think we need to be sensible, we need to be rational, but most importantly we need to look at evidence-based medicine. We need to look at what the evidence for each technique is, and we need to take that in the overall light of the disease and do the best we can for every individual dog. But most importantly, to finish up, I believe in giving all of the people all of the options all of the time. And it's not for me to judge whether you want it or not, but it is for me to make sure you're fully informed all of the time and you have those options. All right, so now let's look at the radiographs of this little dog Xena, and let's first look at the radiograph of the elbow here. What we're looking at is the elbow like this. This is the humerus, this is the radius, this is the ulna. You can see exactly what I was telling you about, which is increased whiteness here. So that increased whiteness represents increased pressure of this region down on this region, which means there's a poor fit going on here. So this is remodeling. The other thing that you notice is new bone formation around the joint here and around here. This new bone formation is called osteophyte, and it's representative of inflammation in the sac that holds the fluid in. So there's pressure between here and here. But unfortunately, that's hidden behind the radial head, so you can't see if there's any fragmentation or not. You have to move over here to the CT scan to see that, and you can see as we scroll through from behind the radial head, you can see in fact that that's fractured off there. There's a little fragment right there. So you can see a little fragment right there. So this is in fact fractured off because of pressure coming down here. This has come away like an avalanche or an earthquake, and that is a fragment inside the joint. But as I've already told you, that's not the real problem. The real problem is friction, persistent friction between here and here. And that persistent friction is going to give rise to pain over time. And initially what it gives rise to is osteoarthritis. So a lot of people ask me, when will my dog get arthritis? And what they have a real problem with is how a 6-month-old dog can already have severe arthritis, i.e. inflammation of the joint. So arthritis means joint inflammation, just like dermatitis means skin inflammation. So this term arthritis occurs because of all developmental elbow disease. So the arthritis is represented in the dog by the puffiness I showed you when I pressed on the side of the joint there, and on the radiograph it's represented by this new bone formation, which is inflammation in the lining of the joint, or the synovium, and that's called periarticular osteophytosis, which is new bone formation around the joint. So the salient findings on this elbow radiograph and CT scan are severe arthritis, evidence as new bone formation, subtrochlear sclerosis, which is increased whiteness underneath the notch of the ulna due to increased pressure, and fragmentation of the medial coronoid process, which is the inner part of the ulna here, and it's already cracked off. And we can see from the top here, if we look down on this, we can see the radial head here, and we can see that there's 2 fragments here which have come off the coronoid process. So now you can see with 3-dimensional imaging, which is CT scan, you can rotate everything in 3 dimensions and look at it so there's nothing hidden. The next step with this dog is to go in and arthroscopically inspect the joint, clean the joint up in terms of the fragments, but I've already told you that just doing that will not resolve this dog's problem. What will really help this dog is to unload the medial compartment or take pressure away from where it's rubbing. So we are going to have to counsel Xena's mum and dad to Xena's animal guardians, owners, to accept that a simple intervention may not be enough here. The other thing that we've got to get them to accept, and we've got to get the general public to accept, is we can't cure arthritis. If we could, we'd probably win a Nobel Prize. But all we can do is do our very best to make sure that that little puppy is taken from its painful state into a non-painful state. And that's our, as I've said before, that's our moral responsibility. But it's not enough to be able to do something. You need to do it because it's the right thing to do. For that puppy, with that owner, in that moment in time, with that particular amount of finances, for the long term. And look at the psychological and physiological impact of what you're doing on the puppy, whether it's worth putting the puppy through it, whether the longer term is going to justify what you're going to have to do in the shorter term. And ultimately what it's about is having that puppy go back into a loving home where that puppy represents an important member of the family. And our job is to just listen to what the people are telling us about their concerns, rather than what we think are their concerns, and then deliver for that puppy the best option, having taken all of that into account. And that's what we're going to do. Elbow arthroscopy is the gold standard for determining the degree of pathology within any elbow. And when we perform arthroscopy, it's through a keyhole. This tube here goes inside the joint, and inside that goes a camera, which is this fella here. So the camera goes in there, and then I can see on the screen here, I can see on the screen here whatever I'm looking at, in this case my fingers. So we're about to stick this camera in the joint. Now, for the purposes of transparency, this is a different dog. This is not Xena. So this is in fact another dog that has elbow disease. And we're going to have a look in the elbow and see what's going on. Right. Okay, so in this dog, this is a classical example of the other end of the spectrum. So this dog is 6 years old, not 6 months old, and suddenly got lame. Some dogs have fissures underneath the surface, like the beginning of an earthquake without the actual earthquake happening. And these pre-shocks and aftershocks occur as fissuring happens. And in fact, you can have a situation where the fissuring is going on for years. So you can have a dog that's been intermittently lame for years, like this one has, and then suddenly goes very lame. And that means the earthquake has suddenly happened. In this case, the earthquake has suddenly happened, but the cracks were occurring for a long time before that. So what I'm going to do with this case is I'm going to be able to just do keyhole surgery, which is arthroscopically guided surgery. And this is kind of cool for you to see, because what I'm going to do is I'm going to make a cut into the joint. You can see the blade coming in there. And then what I'm going to do is I'm going to get my colleague here to hold the hammer, and I'm going to bring this chisel or osteotome into the joint, and I'm going to chop off the tip of that and then pluck it out. So you can see the chisel going in. There you go. Okay, so I'm going to guide that down here, and then my colleague's going to tap it with a hammer. Do it. Stop. Do it. See that cleavage plane, Daniel? Mm-hmm. See that coming up there? So now we're taking the piece. Do it. Do it. Stop. Do it. Good. Do it. Do it. Good. Okay, both hands on. I'm now separating the fragments from the soft tissues and ligament attachments, which you can see on the screen. I'm then going in with little grabbers here, and I'm going to grab the fragments and pull them out. This is called the crocodile maneuver, because it's like a crocodile pulling somebody down under the surface. So this little fragment is holding on there because there's a piece attached to him. So I'm going to go in with my knife and I'm going to cut that piece off. Then I'm going to go back in with my grabber and grab it. And we're pulling on the fragment, and there we go, there we go. So that's a big fragment inside the joint there. Now we're just going to clean up the other little fragments. And now we're just going to scrape off the edge. Good, so we've removed everything now, and you can see on the screen there's a big hole, but that's fine. It's just the tip removed with the fragments, and this dog will do well. That procedure took 4 minutes and 27 seconds. So people who are concerned that this op takes a long time, that's incorrect. And then we'll just end up with 2 stitches and the job done. The dog will walk fine tomorrow. So that's a good example of an arthroscopically guided fragment removal and subtotal coronoid ostectomy, which we're going to have to do on the little doggy as well. The young doggy called Xena that we saw earlier will have a similar procedure, but that dog also, not only will it need some focal treatment, but will also need some corrective surgery to correct the incongruity or the poor fit of the elbow. Because, as I said to you, in very young dogs that are badly affected, you need to try and correct the cause as well as the effect. And the effect is the fragment, but the cause is a poor fit of the elbow. So developmental elbow disease, take-home message. There are many, many hundreds of different types of disease, and there's a different kind of treatment depending on the individual presentation. So this dog should do well.